frustrating, right? Because people might be like, what's wrong with me? Like, why can't I finish this project? Or why can't I, complete this task? Hello, lovely people. Welcome to my virtual couch. Happy Friday to you. So today I have Lindsey McDaniel. She is a social worker. Her credentials are LCSW-C. And today we're going to talk about all things ADHD. This is something that it's on the rise. So we're going to have a conversation about it. And so, hi, Lindsey. Welcome to the virtual couch.
Hi, thank you for having me.
How are you today?
I'm doing well. How are you?
I'm good. So, it might be helpful to have the audience get to know a little bit about you. So, if you don't mind introducing yourself, even though I did introduce you a little bit, and what got you into social work?
I'm Lindsey. I am working as a psychotherapist now, trained as a clinical social worker. I've been working in mental health care for 16 years. Yeah, for 16 years. For 18 years, actually. I got into social work because originally thought about being a psychologist because I liked the intersection of the brain and the body and emotions, and I wanted to do research study on that. And I volunteered in a research lab, and long story short, working with animals is really tough. And I found that was maybe not for me. And I found also that I wanted to have a little bit more of an impact specifically on the individual, so not the kind of higher level research or policy level, but the face-to-face level. And I thought that rather than studying psychology, that social work would be the best fit for me. So I feel like it was a good choice for me.
Yeah, 18 years, that's a long time. Do you feel like time has flew by?
Yeah, part of that time I was in graduate school working in mental health as a student, as a graduate student, but most of that time it's just been my career, and it feels, saying 18 years sounds wild. It sounds like it couldn't possibly have been that much time, but
Yeah. Yeah, it literally flies.
Mhm.
So, can you tell me about the work that you do with clients that may have ADHD or also like cognitive, what do you call it, like deficit or
Mhm.
executive functioning? Like, how can you tell me about your line of work with the folks that you work with?
I work with individuals, with adults individually, and I also run groups, and ADHD and other kinds of executive functioning issues often come in as issues that my adult clients are facing. And I also run a group specifically for women with executive functioning issues. I broaden it to executive functioning rather than ADHD because it is really difficult to sort out the difference between ADHD and other disorders, because there are so many co-occurring disorders with ADHD, but also because the symptoms of ADHD show up in other places. So regardless of what specifically is causing the symptoms, many of the skills and strategies you use to kind of optimize your functioning are the same. So we do the group all in one, even if executive functioning challenges are coming from anxiety or depression, trauma, OCD, things like that, autism.
Okay. Okay. So can you give a brief overview, right? Because we know obviously people need to be evaluated, but a brief overview about the signs and symptoms of ADHD.
Mhm. So I guess I would say, when you're thinking about ADHD, I think we typically picture someone who's hyperactive, really struggling to sit still and struggling to pay attention. So what that looks like for most people, it's a little bit more nuance, because there is difficulty kind of directing your behavior in the direction you want it to go, and directing your thoughts in the way that you want it to go. Folks with ADHD struggle with impulse control issues, really have a hard time stopping themselves, disorganization, sometimes in kind of their speech or in how they're thinking, or sometimes just the space around them is disorganized. They may have difficulty prioritizing. Everything seems the same amount important. It makes it really hard to start things. Consequently, difficulty with time management is really common as well. It can be very hard to initiate tasks, to get things started, and to focus on them long enough to complete them. Restlessness or fidgetiness or difficulty sitting still is a main sign for a lot of people. Because of the difficulty with impulse control, there can be difficulty regulating emotion and difficulty tolerating frustration. People can sometimes have a hard time keeping track of what they're doing in the moment. Like, it's kind of like walk into a room and forget why you're there. It can be difficult to shift attention from task to task on purpose. So while on the one hand, people with ADHD can be very distractible, can kind of, kind of be working on something, have another thought and forget what they were doing. They're off on this thought. They can also hyper focus. So they get locked in on something and they can't shift away from it. So it's not just about not being able to pay attention. It's more about how well you can direct your attention where you want to. And that's where the difficulty lies. Sometimes it's really tough to do things like follow a sequence of steps, sometimes because it's difficult to remember all of the pieces of the sequence. You can, again, get lost in one and forget what comes next. Also, similarly, it can be difficult to remember what you've just heard or read. So those are some of the main signs or symptoms that you might see with ADHD, or more generally with executive functioning challenges.
Yeah. I like that you also mentioned the hyper focus too, because oftentimes people just focus on the inability to sit still and the difficulty concentrating, but there's also the hyper focus as well. What you mentioned, that going into the room and forgetting why you're there, I'm like, oh, I get that a lot. Should I get evaluated?
Yeah.
Do you see that there's a rise in people coming in thinking that they're having ADHD?
Yes, very much so.
Yeah.
I have only speculation about why that is. The big thing that I think is having an impact is the pandemic. 3.5 years out from the start of the pandemic, routines are not all the way back for a lot of people. And they were disrupted for a long time. And for many people who have ADHD or some form of executive functioning challenge, routines are critical to functioning well, to kind of staying organized, to managing emotions. And when they're disrupted, it's really hard to bounce back. So a lot of folks who had found what worked for them had that taken away. And so people who may have had ADHD but kind of function fine, just were not functioning fine anymore. Another thing that I think has changed over the years, and the pandemic, I think, accelerated this, is an openness to behavioral health treatment. And so people who were struggling with these symptoms are more likely to come in and seek support around it versus struggling alone or blaming themselves. They actually are willing to frame it in another way, in a way that allows them to seek support.
Yeah. I also do agree with your speculation. I guess, we need a few more years for the studies to come out, but I also think that the pandemic has caused this This rise, yeah, okay. How does ADHD affect the brain?
So there's a few different ways that it affects the brain, but I think something to hold in mind about ADHD and its effect on the brain is that it's not totally clear everything that goes on. We're still working on it there's still research being done to understand the impact on the brain and why it's like that. It seems like there's a few different systems of the brain that are affected, that are different for people who have ADHD. The frontal cortex, which is the part of the brain that is responsible for executive functioning, planning, organizing, deciding, it tends to be smaller in folks that have ADHD. Um, there's another part of the brain called the basal ganglia that communicates with other parts of the brain and may also be responsible in some ways for inattention and impulsivity. That is also smaller for folks that have ADHD. There are also some studies suggesting that there are some differences in a couple of other parts of the brain, like the limbic system, which regulates emotion, and the reticular activating system, which is actually the part of the brain that communicates between the brain and the rest of the body. It's really hard to tell if it's the brain structures or their impact on things like how neurochemicals of the brain, like dopamine, norepinephrine, are picked up by nerve cells, like if they are picked, if the messages basically are getting through adequately. So there's still work to be done to figure out exactly what's going on, but there are clear brain differences. So when people are talking about their experiences with ADHD, and we're kind of trying to understand, like, why can't you just do things the way neurotypical people do it? They're wired differently. Folks with ADHD really, they have different brains. That's not good or bad, it just is. But it is something I think for all of us to understand so that we're not expecting one kind of brain to function like another kind of brain.
I sometimes might have clients that will come in and say, I think I have ADHD, but when we really dig a little deeper, we see that there's external factors such as anxiety, things that are causing anxiety, right?
Mm-hmm.
What would you say is the difference between someone having anxiety and ADHD?
I guess the difference would be, well, I guess among the differences are how long you experience the specific executive functioning challenges. Some of the ones that are really common are trouble focusing, motivating and initiating tasks, and regulating emotions. So that's the same kind of impact, but the cause is different. And the neurology behind it is also different. So the way that you treat it with medicine is very different. For ADHD, it typically begins in in ADHD, it begins in childhood and is consistent. Those skills may help you manage it differently at different times. The struggles remain kind of consistently is consistently there. With anxiety, the struggles are transient and situational. You may, for some people, they are more prone to anxiety. They may be more likely to experience life in a way that leads to anxiety symptoms. And that has to do with how they're thinking about things, but not necessarily the same kind of wiring differences that people with ADHD have. Um, One of the tricks around this is that ADHD frequently leads to consequences that cause anxiety. So they are really linked very tightly.
Mm-hmm.
For example, if you have difficulty initiating tasks, that may mean you procrastinate and you worry about meeting deadlines because you've waited till the last minute to get started because your brain makes it difficult for you to get started before then.
Right.
Um,
Yeah.
yeah.
Okay. Okay. So that makes sense.
Mhm.
Can individuals live a normal life with ADHD? And what are some tips that you have on how to manage?
Yeah. So absolutely. Um, I think of ADHD a bit differently than some of the other kind of mental health disorders that we deal with. Um, One, because it doesn't really go away. Like you may have remission from some other things. Like there are episodes, for example, of depression or of mania, but ADHD is pretty stably present. But
Mhm.
it's a different way that your brain works. You think differently. And I think the
Mhm.
world needs that. I don't think that we need an entire world of 7 billion people who think the same way. I think there's a real benefit
True.
for folks who say can hyper focus on something really important to them. And those people dig deep and think differently and learn a lot and teach us all a lot.
Mhm.
It is challenging to live comfortably with ADHD because the world is not built for neurodivergent brains. It's built for neurotypical brains. So there may be adaptations that you have to make in order to kind of live comfortably. I do think it's worth advocating for policies in schools and workplaces to make sure that folks with ADHD and other kinds of neurodivergent folks are I guess, integrated well into the systems and that the systems are not designed to repel them or make it harder
Yeah.
for them um, to be a part of things. I think
Mhm.
the tips I would say for folks are when you're thinking about work, for example, to choose work that has controllable stimuli, like maybe work where you choose your hours, your location of work so that you can have the right kinds of stimulation around you. So if you have the ability to decide, I'm going to work in an office where I can close my door when I need to focus versus being in a workplace where they tell you, okay, you're going to go work in a cube farm surrounded by other people who are on different telephone calls and things like that. That could be a rough position.
Mhm.
Choosing your work with controllable stimuli is a luxury not everybody has. So
Mhm.
it may be helpful to do things like set up a lot of schedules, calendars, and organization systems.
Mhm.
So if you, because your brain, the folks with ADHD, the brain doesn't organize information as well as neurotypical brains do, have external organization systems that you can rely on.
Mhm. Mhm.
It can be really helpful to learn your signs of overstimulation and set up systems that allow you to re-regulate. So if you know that it's getting too noisy or there's too many things to look at around you, start to notice how your body reacts to that so that you can respond to limit your stimulation and kind of reduce your vulnerability to emotion dysregulation.
Mhm.
There's a book called Delivered from Distraction, and in the book, the author, I think his name's Edward Hallowell, Edward Hallowell and John Ratey actually lists 7 habits of highly effective ADHD adults, and I think they're really useful. So I'm going to just read those out.
Yeah, absolutely.
Um, 1, do what you're good at, and don't spend too much time trying to get good at what you're bad at. 2, delegate what you're bad at to other people. 3, have a creative outlet. 4, organize well enough. You don't have to shoot for perfect. 5, ask for advice from people you trust. 6, keep regular contact with loved ones. And 7, have hope. And basically, we're, trying to go with what works for you rather than try to fit you into a system that's not built for you.
Yeah, I really like that.
Mhm.
Like focus on your strengths.
Exactly.
Yeah, I really
Exactly.
like that. Yeah.
Mhm.
Sometimes I have clients that get frustrated with their spouse or family member that possibly have ADHD, right? And so our work is just how to help them navigate this world, right? So what do you feel like loved ones need to know about helping a family that possibly have ADHD? Let's say it's not diagnosed. What do you think loved ones need to know? And I'm also going to put the book that you mentioned in my description too, so that people can access that resource. That's great.
So when I think about what family members need to know, I think the foundational thing to understand is that that your family member with ADHD is not trying to be difficult. Their brain is different. And so that may mean shifting what your expectations are of them. It doesn't mean lowering them, but it may mean changing them. Many of us have a family member where if we're having an event, we tell them that it starts 3 hours before it actually starts so that they'll show up on time. Those kinds of tips can be helpful if we know that there's somebody who's going to be, chronically late. It may also mean helping them develop the kinds of structures and routines that help them stay organized and engage with other people who are expecting a more typical, I guess, a typical style of functioning. Even though there's nothing wrong with having ADHD, it can be really hard when you're expected to function like people who don't. And so developing systems to help you manage in those situations can be great. And so having the family members understand that and work with people to develop and maintain those systems can be really great. I think it's helpful for them to remember that it's not a matter of willpower. This is a difference in the brain. And so there are like specific concrete skills that you can put in place to make sure that the important stuff is getting done. But it's not going to be a matter of, well, if you want it bad enough, you'll do it, right? It doesn't work that way. And I think, a big part of this is being honest about the impact that it has on you too. Just because their brains work differently doesn't mean they're not still accountable to the people that they love. And there are ways of kind of making sure that, everybody gets their needs met. For example, I was thinking about in my own family, my mother, I would say, is likely to have ADHD. One of the signs that we see a lot is she hyperfocuses and it comes out in her speech. And so sometimes she will go on a deep dive while she's talking to you about something that you don't know anything about and might not be super engaging, and does it in a way that may kind of block other people from being in the conversation because she's very into it. So my brother, when he was younger, developed a system with her. One finger up means you have 30 seconds because you're losing me. And that's her sign to wrap it up. And 2 fingers means you need to wrap it up now or I'm going to leave. And it's not to be rude. It's to let her know. It's like you've kind of gone a little further than the people around you are ready for. Those kinds of signals can help people with ADHD manage some of the social anxiety that they experience by having kind of, different interpersonal challenges that come alongside ADHD. So family members can be really helpful around stuff like that.
Yeah, I like that. It's that visual cueing, the 1 or 2 or whatever, because then that kind of pauses the brain and go, oh, wait a minute. Yeah, so I do like that. So you did provide a resource for people to go to with the book. Are there any other information or resources that you feel like people need to know about ADHD or testing or treatment?
Yeah. So when it comes to ADHD testing, it's really challenging to get testing because testing needs to be done specifically by a psychologist. It's called psychoeducational testing. That's the gold standard for establishing ADHD. Typically, it rules out other things. So because the symptoms show up in so many other things, it's essentially diagnosis by elimination. So the testing really helps you to do that. They evaluate your history, and that may mean they get collateral information from schools that you've been to, from your parents, from your spouse. And it can cost thousands of dollars, and it takes a significant amount of time. It may be hours of testing. And a challenge is that in modern American healthcare system, we're looking for insurance to cover this, and that's pretty hit or miss. Many insurance plans, maybe even most, are reluctant to cover this for adults. That said, it is available out there. You would go to usually like a directory of therapists like Psychology Today or Therapy Den, and you can search for people who do psychoeducational testing to identify psychologists in your area who may offer that testing. In terms of treatment, the testing isn't necessary in order to directly affect kind of some of the functional goals of living with ADHD. So psychotherapists can and do address the symptoms of ADHD without the formal testing. The testing is helpful when it comes to medicine because, as we talked about before, the structures of the brain involved in ADHD versus anxiety versus other disorders are different. And so the medicines involved may need to work differently. And so understanding what exactly is causing the symptoms has a major impact in terms of the medicine that you'll be prescribed. But that does not mean, not having the testing does not mean that there aren't things that you can do to improve your functioning. Yeah. When it comes to resources, there's a growing amount of stuff out there that you can use to learn about ADHD and about living with ADHD. Some of it is better than others. If you go on TikTok or you go on Instagram, you can find a lot about ADHD. Not all of it is really good information. If you were to look for some good sources for like an introduction to it, I think the magazine, the online magazine Attitude, ADD, magazine is really helpful. Lots and lots of articles. CHADD.org, CHADD.org is another really helpful website, and they have a lot of information about things like support groups for families and for people who are diagnosed with ADHD, children and adults. Understood.org is another organization that has a lot of stuff. And there's a YouTuber who has a series called How to ADHD. There's a lot of informational videos about ADHD, about tips for functioning with ADHD, about how ADHD interacts with other mental health challenges that I think is a really good introduction.
Awesome.
For folks who are looking for books, there's a book called Order from Chaos by Jaclyn that has a lot of specific strategies for building those organizational structures in your life that help kind of buttress your functioning. There's another book called Brain Hacks by Lara Honos-Webb, who that also has a lot of similar structure and routine building tips. And then there's the book Delivered from Distraction, which is an overall review of what ADHD is and how to live your life with it. And that book's Edward Hallowell and John Ratey. In addition to some of the like resources about what ADHD is and what it's like to live with it, there's some resources in the world that help a lot with living with it itself. And a big one is calendars, reminders, and alarms. So Google Calendar is your friend. Alarms are your friend. Use those a lot. There's even special visual clocks that will kind of show you the elapsed time. It's like it covers up the numbers, and once the whole, like say, hour is covered up, you know that you've kind of done your block of focus time. There's apps like Remember the Milk, Brain Focus, ToDoist that are helpful with things like managing your to-do lists and keeping track of regular events that you need to do. And there's also apps like Mint that help you manage your money, because one of the things with kind of ADHD is that a lot of folks find that in addition to difficulty with time management, there's also financial management challenges.
Yeah, yeah. Lindsey, you have given a ton of great resources. I'm so excited. Thank you so much. So I'm not going to ask people where to reach you, because I know you do not accept private clients because you already booked a visit with your
Oh,
daytime
yes.
physician. But I do want to thank you so much for this interview, and I appreciate your time. Thank you so
Of
much.
course. Thank you so much for having me. It was great to get to do this. Thank you.
Great. Thank you. Bye-bye.
All right, bye.